Pleasant good afternoon to all. I welcome you to this, our second press conference. My name is Cuthbert Knight, and I'm the Permanent Secretary in the Ministry of Health, Wellness and Environment. This is our second press conference in the month of January and for 2021. We will be having this press conference approximately up for about an hour or two. We will also be limiting the number of questions per journalist. Because we are doing this conference via or virtually, I ask that persons please keep their mics muted until you are asking a question, and let us try please to prevent any background noise as much as we can do so. Today we will have presentations from a number of technical persons within the Ministry of Health, Wellness and Environment, as the purpose of this press conference is really to provide further update on our national response to COVID-19. We are extremely grateful for your participation, and we look forward to your questions and to a very interactive session while we share information with you. Today is Tuesday, the 26th of January, 2021. I will be your chair for today. We do have an agenda, and I will introduce the various persons who will be speaking. I also wish to let you know that some of our presenters will be presenting from their various locations. As I said, this is a virtual platform on which we are having this conference. I will ask again, please, that we keep all our mics muted. I said also that we will be limiting the questions per media house. We will ask persons or limit persons to two questions per person. Please also know that the persons who are participating today, we had asked that persons register themselves to be able to participate in this session. I will now turn you to the agenda, and we have our Minister of Health, the Honorable Sinclair Prince, who will be delivering some remarks to us. And we will ask our epidemiologist, Ms. Tamara Bob, to stand by as soon as the minister is finished with his presentation. I will now ask the Honorable Minister of Health, Jimmy Sinclair Prince, to bring us brief remarks, please. Minister.
Thank you very much, Permanent Secretary, Mr. Cuthbert Knight, senior officials of the Ministry of Health, Wellness and the Environment, those officials who will join us later on, members of the press, members of the public listening and watching here today. Good afternoon. The last time we met like this, we mentioned that we would periodically come to you to update you on what we are doing as we respond to the current pandemic, COVID-19. This, of course, is in addition to our daily press releases emanating from NEMO and the Prime Minister's briefings outlining progress and responses so far. As you know, we have been reaching out to all our social partners to join in this fight. Over the last few weeks, we have observed an increase in the response from people in regard to the adherence to the established protocols. More and more, we are seeing that people have been wearing face coverings. Of course, we would like to see more of this as we try to prevent the spread of this virus. We continue to strongly urge persons to wash hands and sanitize constantly. We also urge the appropriate physical distancing. Observe the protocol with respect to indoor and outdoor gatherings. While some people are making an effort, too many of us are not taking the protocols seriously. I'm appealing to all concerned, people with shops, bars, leaders of churches, operators of public transportation, funeral directors, and the like. Please insist that your customers, your congregations, wear your masks and observe their social distancing guidelines. For us to fight this pandemic, everyone has to be on board. This is not just a government fight. It never was, never will be. Everyone has a stake in this, in his health and well-being, and therefore everyone has to be advocates of the protocols. Those in quarantine must remain in quarantine for the prescribed duration. Breaking quarantine is irresponsible and dangerous. You endanger the health of your friends, your loved ones, and you put further pressure on the system. We will continue to work with law enforcement and community leaders as we seek new ways in fighting this scourge. The Ministry of Health, Wellness and the Environment is committed to slowing the spread of COVID-19 across St. Vincent and the Grenadines. The Health Services Subcommittee, in light of the recent uptick in the number of cases, has recommended several guidelines and guidance documents applicable across all sectors. These public health measures must be observed if we are to slow the spread of COVID-19. We are trying to, as we say, flatten the curve. To this end, we have identified the key elements to a successful response within the disaster management and risk reduction framework. The last time we met, I outlined these key elements. I think at this briefing, it is important that we put some meat on the bones so you can get an idea as to how we are approaching this pandemic. Number one, early detection. The Health Services Subcommittee over the last couple of months has adjusted our protocol for passengers arriving via sea and airports based on our local context. We've moved from home quarantine to partial tourism approved hotel and home quarantine to now a full tourism approved hotel quarantine. At the moment, all passengers arriving from a high risk country must spend 14 days in a tourism approved hotel. Our vigorous contact tracing allows for early detection, quarantine, and isolation measures. Testing. Thus far, it is important to note that we've processed over 30,000 PCR samples. At our facilities, we currently offer rapid antibody testing, rapid antigen testing, and PCR testing. Those are the three tools that we'll be using in our testing regime. In containment, our response in this capacity has always been geared towards having adequate supplies of PPE for our public health team on the ground, our flu clinics, and our wider health services. Our storage capacity has expanded, and our health disaster coordinator and her team will continue the procurement process despite the challenges. Our methodology has been to find, to trace, to test, isolate, and also offer psychosocial support done by our psychosocial team. Those who fail to comply with our quarantine and isolation requirements can be charged as per our amended Public Health Act. Remember, we went to Parliament to ensure that this happened. For treatment, currently, there is no cure for COVID-19. COVID-19 patients who require hospitalization are admitted to the Argyle Isolation Facility, that facility which we built earlier on. As of last evening, we have 16 persons admitted. Patients who require more high-demand care are currently housed at the Milton Cato Memorial Hospital, and all 7 persons are in stable condition, currently under the supervision of Dr. Woods and his team. 5, risk communication. Risk communication has proven to be one of the most important pillars during this pandemic. We always strive to provide timely and accurate information Our communication team has utilized all available resources within both our public and private sectors. And of course, we continue to urge the public to listen to authentic, reliable information and don't get led astray by the sideshows. The technical team under the leadership of Dr. Kiza Beach has been working around the clock, keeping the public informed, making swift but considered decisions to ensure as much as possible that there is an environment that is conducive to the maintenance of the health and well-being of as many persons as possible, even as we adapt to the ever-changing situation. Now, I'd like to look at some of the tangible areas that we have been updating. Enhanced operation of flu clinics. I'd like to speak a little bit about that. To date, we have set up 9 flu clinics across St. Vincent and the Grenadines, 1 in every district. And of course, we have divided, well, it was divided, the entire country divided into a series of districts. We have designated at least one clinic to deal with the pandemic solely. We advise anyone experiencing flu-like symptoms to visit the one closest to you. The flu clinics will offer screening with rapid antigen tests, which allow for immediate diagnosis of COVID-19 in persons with flu symptoms. The flu clinics are also tasked with the responsibility of doing contact tracing, exit screening, and testing, providing adequate sick leave for persons in quarantine or isolation. These flu clinics are staffed with nurses and district medical officers to meet the demands of the clinics and the provision of other services such as antenatal and childcare, etc., which you have become accustomed. Some private laboratories have indicated their willingness to participate in testing for clearance and exit screening. Of course, we've had a lot of complaints in this regard. Persons wanting to leave cannot do so because they did not get their results back on time. We're trying to correct this. And of course, this has been happening because of the sheer numbers that we've had to deal with over the past few weeks. Thus far, there is one private lab with the approved capacity to do PCR tests for clearance and exit screening. An additional private lab has indicated its willingness to perform rapid antigen testing for exit screening for persons traveling to the USA. These 2 labs, Sigma and CRL, and Sigma will specialize in the PCR. They can also do the antigen, and the CRL is willing to do antigen testing. So if you have a problem waiting on it from the Milton Cato lab, the MLU, which is the molecular laboratory unit, you can go directly to one of these labs and do your testing and get your results according to the arrangements you make with them. We have recently secured a high throughput extraction equipment instrument, which will significantly improve sample processing, clearance of backlog tests, and the issuing of results. Extraction is the most labor-intensive and time-consuming part of the PCR process and requires a biological safety cabinet and technical personnel. What we already doing here is that we have procured a piece of equipment which will reduce the time, the extraction process time, by about 2.5 hours. And this, of course, we hope is going to make a considerable dent in the waiting time for results. Given the current travel restrictions due to COVID-19, a team of local biomedical engineers, IT professionals, and laboratory technologists is remotely engaged with a specialist team to undergo the requisite training and subsequent installation of this instrument. The instrument is expected to become operational by the end of this week. So training has started, but the experts are overseas, but they're going to do the training by Zoom. And as we speak, the chief technologist and other people are in training right now, online. I'd just like to mention also that additionally, we have secured some 4 technologists from Cuba to add to the number of technologists that we have at the MLU. And this, of course, is building capacity. And we are happy that we're able to get our Cuban friends to come at this time because, you know, this is a specialized area. We wouldn't always have enough people in this area to help out. In response to the global COVID-19 pandemic, the government of St. Vincent and the Grenadines constructed, equipped, and staffed the Argyle Isolation Facility to provide care and treatment for COVID-19 persons who require hospitalization. Given the recent uptick in the number of COVID-19 positive cases here, the government decided to increase the areas to isolate, care, and treat for COVID-19 positive persons who do not require hospitalization and cannot properly undertake self-isolation in their own homes. In an effort to mitigate and control the spread of the virus, to this end, the government has leased a self-contained 25-room facility for 6 months in the first instance. I've been advised by the Permanent Secretary that we may get 1 or 2 other facilities that we can add to this should the need arise. Of course, the state will provide the requisite security at the facility, but you are required to bring your own food and linen. Of course, this will go a long way again in helping us to relieve the pressure we have on the AIF, that's the Argyle facility. People who are not sick, not showing symptoms, but are positive, and even people who are sick, I suspect that the CMO and others will decide as time goes by. But we have secured these facilities, and we're going to make use of them. Nevertheless, at this phase, home quarantine and isolation are recommended for those who can safely and properly quarantine and isolate themselves at home. Of course, we do not expect there to be a mad rush of people coming to this facility, but there will be a means test, and the officials will, of course, examine and assess whether or not a particular patient can stay at home and do the quarantine rather than having to go to another place. I'd just like to say a little bit on vaccine preparation, because you know that is one of the ways in which we can prevent all over the world. People are talking about vaccines, etc. But we don't want to be caught flat-footed. And a technical working group of local health professionals was established and given the responsibility of ensuring SVG's readiness to receive COVID-19 vaccines. To date, the technical working group have developed and submitted for the requisite requirement to meet this objective. It is currently negotiating with 2 vaccine manufacturers while exploring several promising advancements for the provision of vaccines through the COVAX and African medicinal platforms, and also the Indian government. We have commenced the required risk communication, including the training of healthcare workers, among other target groups. So we ought not to wait until there is vaccine on the ground before we start to do some work. We are also doing some other infrastructural work. That is in MO about that later on. But we are trying to put the infrastructure in place so that when the time comes, we'll be ready to roll out the vaccine. In terms of other supplies, an adequate quantity of supplies are in stock with additional orders pending as the global demand increases. We currently have over 300,000 N95 and KN95 masks, 339,400 surgical masks, and a quantity of dust masks. Disposable gongs amount to 27,000, just over 27,000, and full PPE kits amount to 1,900. As a contingency, each of the NEMO satellite warehouses has PPE supplies, and the main warehouse has over 4,000 gongs. Additionally, to augment our efforts, we received over 100,000 gongs and other supplies from PAHO at a value of over 133,000 US dollars. Of course, we've been leveraging, we've been taking gifts and donations, etc., from all our international partners, and we are putting them to use in this way. I take this opportunity to reassure you that this ministry will continue to take the appropriate measures to control the transmission, to eradicate cases and clusters and prevent community transmission, to reduce the burden on healthcare facilities by rapidly finding and isolating all cases, providing them with appropriate care and tracing, quarantining, and supporting all contacts. I also implore us to all play our part in helping to mitigate the chances of possible community transmission through infection prevention and control measures, such as hand hygiene, as we said before, respiratory etiquette, physical distancing. I'd just like to take this opportunity to thank all of our frontline workers, all the persons who have been at the forefront of this war and this response against COVID-19. I'd like to thank the CMO, the MOH, and their team, the people at NEMO, people in law enforcement, people in the communities, the doctors, the nurses, etc., at the hospitals, everybody, the officials at the Ministry of Health, everybody, for working around the clock to ensure that St. Vincent and the Grenadines continues to be safe. It is the hard work of these people that will take us through this dungeon that we have found ourselves in as a global community. As I said before, at our last meeting like this, it is not just a health issue. It is an issue that has economic and social ramifications, and the government has been taking into consideration all of these considerations, and trying to make a balance out of it. And so we wish that the public itself would decide to take ownership of the fight against this pandemic and to do what is necessary to make sure that it does not run rampant throughout St. Vincent and the Grenadines. I thank you very much for listening, and later on you'll hear more from other members of the team, and we will continue to talk to you like this, and we'll have people from different sections of the ministry and from NEMO to talk to you as is necessary. Thank you.
Thank you, Honorable Minister. You indeed have been prudent. You have heard a very informative presentation, and you would have received a very thorough update on where we are. As you know, the minister has been with us just for a very short time. He has been participating in all our press conferences, and he is clearly showing the leadership which is required at this time. Health indeed is our shared responsibility. We will now have our epidemiologist, Mr. Mara Bob, to brief us. And I would ask our senior nursing officer in the community health service and our hospital administrator to please stand by. Ms. Bob.
Minister Prince, CMO C0VID, PS Knights, and other health officials, members of the press, listening and viewing audience, good afternoon. At this time, I'm just going to share briefly with you an update on two things. One, the COVID-19 cases since our report last night. And two, give you an idea of the distribution of our COVID-19 cases with no travel history. I'm going to start sharing my screen now so you can have a visual. So since last evening's report of 17 new cases, we have recorded an additional 11 local or cases with no travel history. As such, as of 12 p.m. today, we have 774 cases recorded in St. Vincent and the Grenadines, 619 of which are currently active. A further update regarding new recoveries and any additional cases will be provided in this evening's daily report. So now we're going to take a look at the distribution, and first, we are specifically going to be looking at the COVID-19 cases with no travel history, and we're going to be looking at them by age group, gender, and take a look finally at the health districts. So we've done a preliminary analysis in this regard. We're still in the process of obtaining some missing data, age, address, gender, and so forth, which from time to time may not be included on a particular result. In terms of the gender, more females, and that is 47%, have been infected with COVID-19 compared to males, with just 35% of cases being males. We still have 18% for which we cannot identify the gender, and so we will update that as time goes by. Now we're going to take a look at the age group. Most persons who become infected are between the ages of 25 to 44 years old. That's about 37.5% of all cases with no travel history are in the 25 to 44 year age group. Notable also is the 15 to 24-year-old age group, which has about 12.9% of cases, and the 45 to 54-year age group, which has around 11.9% cases. Also note that cases have been recorded in all age groups. And finally, we're going to take a look at the health districts in which these cases reside. Now, the majority of cases, that is over 50% of the cases, reside in the following districts: Kalyaquah, Pembroke, and the Georgetown Health District. The Kalyaquah Health District currently has the majority of cases, and the Kalyaquah Health District ranges from around Annesville all the way to Stubbs area. They have 20.1% of cases. Next, we have the Pembroke Health District with 19% of cases, and that health district ranges from Camden Park to Barley. And then we have the Georgetown Health District with 16% of cases, and that district goes from Georgetown up to Fancy. Also note that cases are present in all health districts, so precautions should be taken wherever you go. Of course, we will continue to provide regular updates as more information is received. Thanks for your attention.
Thank you, Ms. Bob. Indeed, an excellent presentation. It goes to show you that we have been making full use of our energies, talent, skills to ensure that we respond to COVID-19, and also that we have the requisite information to share with you. Rest assured that we stand resolute in our fight against COVID-19. We will not relent, we will not stop until everyone in every square inch of St. Vincent and the Grenadines is safe. Do not forget, we all have a shared responsibility. We are in this together. We will prevail. We will now have our Senior Nursing Officer in the Community Health Service, Mrs. Julie Douglas Russell, and she will brief us on the operations of the flu clinic, screening by district, in district clinics, etc., and the services which are offered there. Mrs. Russell.
Thank you, Chairperson. Honorable Minister of Health, Mr. Jimmy Prince, Permanent Secretary, Mr. Cuthbert Knights, Chief Medical Officer of Health, Dr. C0VID, Medical Officer of Health, Dr. Duncan, the media colleagues, good afternoon. Today, I am going to give you a brief update on the following: flu clinics in St. Vincent and the Grenadines, 2, testing procedure and requirement. And 3, services offered at the other district health centers. Due to the increase of flu-like symptoms and COVID-19 cases, the ministry has decided to have designated resources available to manage the increased cases of flu-like symptoms and COVID-19. Also, another significant reason from a public health standpoint, the designation of these specific flu clinics will allow for minimizing the risk of spreading COVID-19 from infecting other clients who normally visit the health centers. Throughout St. Vincent and the Grenadines, the ministry has designated flu clinics in each health district. District 1 is Kingston Health District, and Kingston Health Center is the flu clinic in this Kingston Health District. District 2, Kaliakwa Health District, Kaliakwa Health Center. District 3, Cedars Health District, Bayabu Health Center. District 4, Mariaqua Health District, Levi Latham Complex. District 5, Georgetown Health District. We have 2 flu clinics in that district, which is Georgetown Health Center and Sandy Bay Health Center. District 6, Pembroke Health District, Layou Health Center. District 7, Chanticleer Health District, Coast Hill Health Center. District 8, Northern Grenadines, Port Elizabeth Health Center. District 9, Southern Grenadines, Clifton Union Island, Canawan Health Center, and Mairo Health Center. Now, our flu clinics are open Monday to Friday from 8 to 4 p.m., except for Kingston Health Center. Kingston Health Center operates on a shift system from 8 to 7 p.m., from Monday to Friday, and on Saturdays from 9 to 12 p.m. Now we're going to be talking about our test procedure. At these flu clinics, we offer to the public anti-rapid tests. These antibody rapid tests take 10 minutes for the result. We also offer antigen rapid tests, and these antigen rapid tests take up to 15 minutes for the result. And then we have the PCR, which takes some days. Now the antigen rapid test and the CPR rapid test, these samples are obtained nasally. Now, requirement for persons to be tested. If you do not have any history of exposure to COVID-19 patient, but you have COVID-19 symptoms, a rapid antigen test will be administered. If the result is positive, the individual will be treated as a case of COVID-19 positive. If the result is negative, then a PCR test will be administered. If you have no exposure, no symptoms, a rapid antibody test will be administered. If positive, a PCR will be taken. Now, there might be history of exposure to a positive person, but no symptoms. We will then do a PCR test to know your status. And if you have close contact with someone who was tested positive on a PCR and the person has symptoms, a rapid antigen test will be administered. If you are positive, then we treat you as a positive case of COVID-19. Other services offered at the other district clinics. We do exit screening Monday to Saturdays from 9 to 11 a.m. At Chanticleer Hospital and Levi Latham Complex, we do it from Monday to Friday. At Bookman Polyclinic and Stubbs Polyclinic, we do the exit screening from Monday to Saturday. On Saturday, it is from 8 to 12 p.m. The other health center continue regular service. So the normal clinical activities that will take place in the health center will continue at the other health centers that we do not have as flu clinics. I take this opportunity, being the senior nursing officer, to say to the general public of St. Vincent and the Grenadines, although life in many countries is returning back to a certain level of normality, the impact and effect of COVID-19 pandemic, such as measures taken to best manage and control it, will require increased effort for adjustment to work and personal lifestyle and economics development on a whole. Try to keep up to date on the government public health recommendation and coping mechanism, and implement these as practicable as possible to assist with keeping you and your loved ones safe. Seek relevant public health advice by contacting healthcare facilities and continue to provide relevant guidance and support to your family and loved ones. Remember that we are all in this together. Together, we are stronger at implementing and bringing about the changes and adjustment necessary for living in this environment of new normalcy due to the impact of COVID-19. Keep safe. Thank you.
Thank you very much. COVID have taught us many things. COVID has brought many opportunities. One of the things it has taught us is that we need to rapidly build capacity. And one notable is that all of the persons who have spoken today are all homegrown. We have learned to enhance capacity and to respond to threats such as COVID-19. Thank you, Sister Julie, for your sterling presentation. Our hospital administrator at this time will speak to us. She's the administrator within the hospital services program, and she will give us an update relating to our isolation facility, capacity, etc. Sister Walters, we invite you to speak at this time.
Honorable St. Clair Prince, Minister of Health, Wellness and the Environment, Mr. Cuthbert Knights, Permanent Secretary in the Ministry of Health, Wellness and the Environment, Dr. Simone Kieser-Beach, the Chief Medical Officer in the Ministry of Health, Wellness and the Environment, senior members of staff in the Ministry of Health, Wellness and the Environment, members of the media, good afternoon. Today I'm charged with the responsibility of updating us all on the admission procedure and for hospital services, as well as capacities and activities at the Argyle Isolation Facility. Now, hospital services comprises all the rural hospitals on mainland St. Vincent, as well as the Modern Medical Diagnostic Center, the Milton Cato Memorial Hospital, which is the main hospital, and recently the Argyle Isolation Facility. Now, as was said before by the minister, the Argyle Isolation Facility came on board as a response to the ministry's approach to addressing COVID-19 infections among our population. Previous to late last year, previous to December, our admissions at the facility was mainly due to the fact that persons in the population were unable to effectively isolate themselves at their homes. So the ministry addressed this concern or this need by the population by opening the doors of the Argyle Isolation Facility. Hence, it was used as mainly as a means of isolation rather than for hospitalization. So today, the number that we have, which is a total of 45 admissions, includes persons who were just admitted for isolation. They were not ill, they didn't require hospitalization, but they needed to be isolated from the rest of the population, as well as those persons who became ill later on. So we've had a total of 44 admissions thus far today. As was recently said by Minister as well, we currently have a total of 16 persons at the facility. Now, some of these individuals at the facility are there because, one, they are receiving inpatient care, and two, because, again, they do not have the capacity to isolate themselves effectively at home. As was also said, this has been addressed by the ministry, where we are now transitioning those individuals who are there for mainly isolation to this new facility that was recently leased by the government for this purpose. As of this month, around the 14th of January, we saw an increase in the numbers of persons requiring inpatient care or hospitalization. Thus, we modified one of our wings at the hospital, Milton Cato Memorial Hospital. So the female medical ward was cleared and is now exclusively utilized for treatment of and care of patients diagnosed with COVID-19 infection. To date, we've had a total of 35 admissions. However, today, as we currently counted, our number is at 7. Persons have either been discharged to continue their isolation at their homes or were subsequently transferred to the Argyle facility. In terms of admissions to the Argyle facility or to the Milton Cato Memorial Hospital's COVID unit, now as we're calling this little intervention that we've done, the process for admission has not changed. The process still remains that persons are referred from whichever various facility, be it in the public system or in the private system, and we've accepted quite a number of patients from the private firms, right? But be it from public or private, persons are still being asked to go through the process because it may be that there are some things we can intervene with at the accident and emergency level rather than admitting a patient for hospitalization. So there has been cases where persons were sent or referred to us for continued care, but were treated and discharged, meaning they were discharged to continue their isolation at their own homes. Right, so the process has not changed. Whatever process existed before for admissions to one of our hospital facilities, that is a process that still maintains, meaning the referring doctor refer the patient using written and telephone referrals as it applies. If the patient if the patient has already been vetted by one of our emergency physicians, then the person can directly go either to the Argyle facility or to the Milton Cato Memorial Hospital specialized unit that we've recently effected so that their care can continue. General screening and testing procedure, we have embarked on rapid screening that is the antibody screening for patients entering accident and emergency units. So you would find if you go to the accident and emergency unit at Milton Cato Memorial Hospital or the Modern Medical and Diagnostic Center, that you may be asked to consent to a rapid screening by the physician. We try to do it on a large scale basis, and especially for persons exhibiting symptoms of COVID-19 infection. We have been asking persons, as you've just heard the appeal from the senior nursing officer, we've asked persons to please not come to the accident and emergencies in our hospital services if you can avoid doing so. Because we do appreciate that the flu clinics are not 24-hour services, so we will pick up where the community leaves off. But as much as possible, we're appealing to the public to go to your nearest health center that offers that sort of service, right? So that it doesn't take away from or put at risk those other persons who are in the facility and maybe safer, right? So the general requirements for persons, you would just be required to do that finger prick at the accident and emergency unit. You may be asked when you're visiting one of our inpatient facilities, you may be asked by the security to answer a few questions as well. And we are still appealing to the public. Bear with the security officers, because this is one of the ways in which we can kind of curb and secure and protect your loved ones who are here with us from being exposed to conditions that they do not necessarily have to be exposed to. We're also in compliance with the protocols of COVID-19 mitigations. We have also asked the security officers at the various facilities to help us to curb our numbers. Hence, our visiting protocols have changed, where we have now we've now discontinued our 11 o'clock visiting hours, and we're just allowing one person per ward, a patient per ward. So if you're here to visit a loved one, mommy and daddy may not be able to go in to visit somebody, or uncle and auntie, the group visits, all of those we've discontinued because we want to limit the amount of persons who are on any one of the wards at any one time. Visitation at the Argyle Isolation Facility, as well as the female medical ward, which we have, which we've retrofitted to make into our specialized ward. Visiting on those facilities and that unit is strictly prohibited. You can, however, drop off stuff for your loved ones if you have. This is done at the security booth at the Argyle facility, and also can be done at the security booth at the Milton Cato Memorial Hospital. Milton Cato Memorial Hospital remains the accepting hospital for all specialized cases. While we do offer a bit of some level of inpatient care for persons in the district, the district really do not have the capacity at this current time to continue or to keep patients infected with COVID-19 for any long stay. So you may find that if a person turns up at the Chateaubriand Hospital, the Levi Latham Hospital, or the Georgetown Hospital, they may only remain there for a short period of time. Probably if they're a suspected case, their length of stay would be to the point where the PCR results comes back. When the PCR results comes back, that would determine where the patient goes. If the patient goes home, or if the patient stays at the facility or is transferred to Argyle or to Kingston, Milton Cato Memorial Hospital. So the persons, do not be alarmed if when you visit one of the health center, one of the rural hospitals, you're told that the person would have to go on to one of these other facilities. Because if the patient is a positive case turning up at one of the rural hospitals, they may not require hospitalization. They may not have the capacity to keep you there for any length of time. So you would have to be transferred to either the Argyle facility or to the Milton Cato Memorial Hospital. We're also joining with the rest of our team members to appeal to the public to adhere to our use of mask or face coverings, and our hand washing protocols. We do understand that we have some gaps in different areas that we are working round the clock to fill. But in the meantime, we're asking you to play your part, wear your mask. While you're at the hospital, the mask is not only to get through the gate from the security. You're required to keep the mask on as long as you're on the hospital's compound. Any of our hospital, whether it is Milton Cato Memorial Hospital or any of the hospitals in the rural communities. So we are once again asking you to join with us to help to mitigate the spread of the COVID-19 infections. Do your part. If you see somebody falling along the way, just remind them to wash your hands, keep your mask up, and do whatever it is. Avoid the crowds, avoid social gatherings of more than 10, keep your distances, and let us all try to work to keep St. Vincent and the Grenadines safe. Thank you very much.
Thank you very much, HA, for your very detailed and informative presentation. You shared tremendous information with us as it relates to the present status of our isolation facility and the present status in our rural hospitals, in particular, our main hospital. We have heard from all of the presenters, and we have gotten to that stage where we will be inviting questions. Again, as I indicated at the beginning, we will be taking 2 questions per media house. And we have a number of persons who are signing here representing media houses. We'll be very happy to have your questions. We welcome your questions. And I ask that you can now ask your questions.
Good afternoon.
Good afternoon. Please, you identify yourself.
Yes, Dale Silver, the Vincent newspaper. My first question has to do, could we have an update in terms of, has there been testing to determine whether or not we have any cases of the variant in St. Vincent and the Grenadines? And also my second question has to do on the issue of testing. I know last week the Ministry of Health, in one of their press releases, mentioned that they were having some issues with testing. There was also a backlog. I just wanted to know where are we at right now? Have we been able to how are we managing the amount of tests that we've had? Thank you.
Thank you very much, sir. And we have with us our Chief Medical Officer. Your questions, you posed the questions about whether or not we are doing any testing or whether we may have seen any variants of COVID-19 here in St. Vincent and the Grenadines. And secondly, you asked about the backlog as to where are we now with that, the status, and how are we managing also the backlog. Our Chief Medical Officer, Dr. Simon Kizabich, will provide some answers or response to these two questions.
Good afternoon, everybody. Minister, PS, members of our health team, media, thanks for being here this afternoon. So I'll try to answer those two questions. One was the question of the variant. As we had mentioned previously, we sent samples to CARPHA, that's the Caribbean Public Health Agency lab, a few weeks ago, but those samples were reported as not having the variant. We will continue to send samples, but as you might be aware, St. Lucia has recorded 5 cases of the UK variant. Trinidad has recorded variants there, and also Jamaica. So it is, because we have similar source markets, as in persons coming from similar areas, we are concerned, and we think it is highly likely, especially because of the disease pattern we are seeing, that we might have the UK virus here, variant here, but we have not had that confirmed from on a lab basis. In terms of the backup so far, we have been having quite a difficult time, you can all say. It's affecting our clients, persons who are in quarantine, persons who have been tested, waiting samples, persons going out on exit screening, persons who are even admitted. And that's because of the large volume. We went from, as you know, 110 cases in early December to now we are over 700 cases. And remember, for each case, you might have between 5 and 10 persons who are contacts who have to be tested. So it's a major increase in the volume. And the lab, we have increased staff. As Minister said, we have increased machines. We have also been partnering with one private lab, and we are quite grateful for that service, where they're taking up a lot of the exit screening and some of the clearance screening. We are also engaged in discussions because, as some of you might know, from today, United States of America requires that you have a PCR or an antigen test to enter if you're coming into United States of America. And we have an AA flight on Wednesdays and one on Friday. So we have entered into discussions with private labs so that they can provide the antigen services for at least the exit screens for persons going to the USA. For persons going to Britain, or persons going through Barbados or St. Lucia, Antigua, you still require PCR. The private labs can also do the PCR. One private lab currently has the capacity to do the PCRs, and as I said, they started before and they should continue. We are trying to streamline even further the entire process of testing. As Sister Julie said, we are not doing PCRs for all persons turning up, because now with the antigen testing that we are offering, symptomatic persons, meaning somebody who comes with a fever, cough or cold, will have an antigen test, and that person will not have a PCR. So that should decrease the load on the lab. We are also streamlining the reporting so that if you have a PCR done and it goes to the lab, you are a positive case, you have been reported as being positive, you will have be given an order, a medical officer's order for 14 to 21 days. Now, the reasoning is that you need at least 14 days to properly clear that virus. The incubation period and the disease pattern normally takes between 14 to 21 days sometimes to clear. It might clear in a shorter space of time. But our rationale is that you will be given at least 14 days sick leave. We will recheck you on day 14, and between day 14 and day 21, you should have your repeat result. If you are positive, and we need to clear you. If you are close contact, and I just want to caution persons, sometimes you might have somebody who is in a large business, say, one person testing positive, and the desire, the interest, that everybody in the business wants to be tested. Close contacts. There's a very specific definition for a close contact, and it includes being up close to the person, less than 6 feet, for 15 minutes, or a cumulative period of 15 minutes in a 24-hour period. So not everybody without a mask. So not everyone who is in the big business facility where a positive person has been will qualify as a close contact. So we are looking mainly for close contacts, and we're really trying to be very specific in terms of who is considered a close contact and therefore who has a PCR. That person goes home for 14 days, sick leave, quarantine order, and the test will be done later on. So if that test turns up, you have your PCR done, you get your result, it's negative, by 14 days anyhow, you should be cleared. And so the need for a second test for a contact is decreased or not necessary. So we are working, as Minister said, Mr. Williams and his team, they're currently undergoing training for an extractor machine, an automatic extractor. So you would move from a manual process to an automated process, and that we expect would significantly decrease our backlog in cases. We ask for patience. It is very frustrating. We understand that. Being in quarantine is a very difficult thing to endure. Sometimes we take for granted our freedom, but if you ask somebody to stay at home and not come out for 2 days, by the time you get to 3, 4, 5, you think, you hate this place. And so the frustration, the anxiety, the not knowing is large, and we appreciate your patience as we try to work together to get through this COVID.
Yes, good afternoon. My name is Beverly Sinclair from Island Media. I would like to find out from the health authorities what happens when a person is tested positive. How do they get home? Is there inspection of the facilities at home to ensure that they have a place to isolate? That is something I'd like an answer to. And also the high number of people who are said to be active, the active cases. Where are these people? Thank you.
Thank you very much, Beverly from the Island Media. And you simply want to know what happened when a person is tested positive. We will ask Shanika John, a member of our task force and also a staff at the ministry, to offer you with a response.
Good afternoon, everyone. So as it is for persons who are seeking care at our various flu clinics, we have advised those persons, one, if you're going to go to a flu clinic with flu-like symptoms, it means that you're sick. So we ask those persons to take all the necessary precautionary measures, which would include wearing a mask. If you have private transportation, we've asked you to take your private transportation. We've seen a lot of that. When you get to the flu clinic and you are tested, you're given, our medical team has a list of specific guidance and instructions and advice that they would offer. So there's a series of questions which persons would ask, which would include their home quarantine arrangement and isolation. Based on those answers to those questions, then we will deem whether or not a person has appropriate accommodation for quarantine or isolation. If you are tested positive, then we ask you to let us know how you're going to get home. And most of those instances, we've seen that persons would arrange their private transportation to take them immediately home or their alternative location, which they have made arrangements for. Okay. The inspection of the home is done by our environmental health team. So once a person is being transferred into their home, if necessary, especially if we have persons who are being transferred from AIF into their home isolation or quarantine area, then that inspection is being done by our environmental team.
Thank you very much, Shanika John. Any further question at this time?
Good afternoon.
Good afternoon.
My name is Brea King from the Searchlight newspaper. My first question has to do with the recovery rate of persons. On observation of the COVID-19 dashboards on a day-to-day basis, 1 or 2 persons have been recovering, but at the same time, persons who tested positive for COVID-19 and are in isolation have been saying that they haven't been contacted for retesting so that they could be cleared. Can it be explained why so few people in isolation have been recovering based on the dashboard? Is it that they continue to test positive, or is it that many of them have not yet been tested? Also, I have a second question. Can I go ahead and ask that, or should I wait for an answer?
Go ahead and ask.
Okay, one of the possible reasons given for this spike was that the COVID-19 positive persons, some COVID-19 positive persons did not strictly adhere to the protocols while in isolation. Given the large number of positive cases presently, what are the measures in place to monitor these cases and ensure that protocols are being followed?
Thank you very much for your questions. So your specific questions are, you wish to understand what is the recovery rate for persons who have tested positive for COVID-19. And you also have asked for the reasons. Well, you noted that one of the reasons given for the recent uptick is the non-adherence, and you wish to understand what measures are in place to monitor such persons. Thank you for your question. And the Chief Medical Officer will provide some answers.
Hello. Okay, so in terms of the apparent slow recovery of cases, twofold. One, as you correctly said, the retesting. But strictly speaking, I'm not sure if you remember before this spike, we had issues where persons were complaining. For example, persons at the Argyle isolation facility, they were reporting that they would test negative one day, then 2 days after they would test positive, and then they would test negative again. And the original recommendations for clearance for persons with coronavirus, COVID-19, had to do within around 14 days into the disease, and then you would do another test, a second test, not sooner than 24 hours. So within 24 hours, you would do the test. What we had been doing between March and December was that we had started testing a little earlier than 14 days. So you might test around 7 days, and quite a few persons would be negative by then. And that's probably because they were much further along in their disease by the time we tested them. So you might test somebody positive and they would already have been, because these are travelers coming in, and even though they tested negative on their pre-arrival test, they tested positively, and then we rechecked them and they would have converted within about 7 days. But then there will be persons much further along in their disease. So oftentimes, some of you might have heard the term about cities or the cycle threshold. Oftentimes, the cycle threshold we will get for those persons would have been around 35 or 33, so that you would know they were further along in their disease. Now we are getting persons who have cycle thresholds at 18, 12, 21. So that is an indication that they are much earlier in their disease. And so the expectation is that they are going to go to their at least 14 days, maybe even further. So the protocols we have that we are using would be to retest those persons around day 14 or beyond that, so that we would get the results more than likely be negative by that time. This evening, you should have some more. If you have noticed over the last few days, the number of recoveries have been increasing. And so just looking at the results today, we saw a number of persons who tested positive 14, 21 days ago, coming up now as negative. So that's one of the reasons. In terms of the other question about what we propose caused the spike in December in terms of persons not complying with their quarantine after they left the hotels. Remember when we started with no hotel quarantine, then we went to 5 days, then we went up to 10, and then we went to 14. And that was because we were picking up that persons were testing positive after the 5-day test. We were getting persons at 9 days. And I'm not sure how many of you saw in the news over the weekend of a case in New Zealand. New Zealand just last week declared that they were COVID-free. And then they got a case of a lady who had done her 14 days quarantine, had her 2 negative tests, and after 14 days turned up as a positive. Okay, so the other, if we want now, we could say, let's go to 21 days quarantine in a hotel. That might be the only other measure you might want to use. But more importantly, whether it's 5, whether it's 10, 14, or 21 days, wear your mask. Wear your mask, socially distance, physically distance, your hand hygiene. So that whether you are the virus is picking up at 5, 10, 15 days, if everybody is wearing your mask, everybody is staying as far away as possible from others, and you're cleaning, the virus has much less of a chance of spreading from one person to the other, whether it's there or not. So we are going to maintain our 14 days in the hotels now. We are going to encourage as much as possible for others outside, because now is a matter of you being not somebody who has come in, but everybody needs to really be compliant, be consistent with wearing your mask. And wearing your mask is not under your chin. Wearing your mask is not under your nose. okay? Because where's the virus? It's in your airway, your mouth passage, your nose passage. So if you have your mask under your nose, if you have your mask hanging on the side of your ear, if you have your mask under your chin, that is not wearing a mask. That is having a mask on your face, but it's doing absolutely nothing to protect you. So we really ask persons to wear a mask properly and wear it all the time.
Yes, I have to redirect my questions. I didn't get an answer to where are the people who have tested positive. There's a high number of around 600 positive cases now. Where are these people? Because very low numbers were mentioned for those who are in hospital and those at the isolation center. So where are the others? And also in relation to transportation and getting home, in any society, there are less people with private vehicles and more people who use the public system. So while there was an explanation for the private vehicles, I didn't hear anything about what is done. Is there a protocol in place for people who do not have a private vehicle to get to their home, which would have been inspected and found suitable for them to go home and isolate? How do these people get home? And we're thinking about controlling the spread of the virus. So how do these people get home?
Thank you for your follow-up. We did see 2 questions, and I am very confident that those questions were answered by Ms. Shanika John. So we will not detain ourselves further with that, because we did discuss home quarantine. We did discuss quarantine and isolation facility provided by the state. We did discuss transportation via private transport, etc. Okay, so I thank you very much for those follow-up. Any further questions?
Yes, good afternoon. Kenton, Chance of Eyewitness News. Is there somebody? Should I go ahead? I heard somebody else was trying to get in.
You go ahead, please.
Okay, good evening, everyone. Kenton, Chance of Eyewitness News on the Caribbean Media Corporation. I have 2 quick questions. The first question is on January the 15th, the Health Services Committee gave permission for 6 persons who embarked on a flight in another Caribbean country, which I would not mention now, where there is community spread of COVID-19, to travel to St. Vincent and the Grenadines without a PCR negative test. Can the Ministry of Health tell us what informed that decision and whether any of those persons tested positive for COVID-19 while in quarantine? My second question is, has the Ministry of Health established any links between or among the clusters, and how many cases have not been linked to a cluster? Thank you very much.
Thank you very much for your 2 questions. And you specifically asked about links between clusters and cases where we may not have linked such cases to clusters. And you did ask about 6 persons traveling to St. Vincent, supposedly without PCR test. We will ask our CMO to proffer some response on these questions for us. While she's coming, I want to remind us all again that we all have a responsibility in the fight against COVID-19. So let us all understand and realize that we have to play our part and play our part well. Okay.
Okay, so the query is whether or not the Ministry of Health uses discretion to give permission for some travelers to enter the country. The Ministry of Health, the Health Services Subcommittee has various protocols. And these protocols, the general protocol, as you remember, at the bottom has at the discretion of the Chief Medical Officer or the Medical Officer of Health. The particular situation is a matter that was assessed as persons traveling in a private plane, and therefore they were all of the same risk level to themselves. They were then instructed to quarantine, as everyone else would, for high risk, coming from a high risk country. And on that basis, because those persons were not at risk to anyone, not posing a risk to anyone else on the flight, they were allowed to come in to the country on the discretion of the chief medical officer, myself. In terms of any other question, you are asking for the personal, private, and confidential information of a client of the Ministry of Health, and it would be against my ethical standards to provide you with that information. Your second question was on the links between the clusters and cases without links. We have cases without links. We have identified some links between some of the clusters. And we are still investigating those persons who we have not identified as having a link to any particular cluster. We have had clusters in churches, in workplaces, and as you can imagine, persons working in a house or going to a church will come from many different areas, many different families. And so that's how you are linking. So I go to this government workplace and I go home, persons in my home, my close contacts become positive, they go to another workplace or another site, and therefore you have transmission along that line. So, but to give you exact figures at this point, we will not be able to do that at this time.
Thank you very much, Mr. Chance, for your questions, and CMO for the answers. Do we have any more questions at this time?
Yes, I have a question. Good afternoon. Jennifer Richardson, the
Please identify
API.
yourself and sure, Mr. Justin.
Yes, a quick question. Yeah, this is based on an experience I had recently where an unmasked person who we would refer to as a street person who came up to me to ask for money. And I offered them a mask before giving them the money, which they took. I was wondering if the ministry has any plans for the distribution of masks among these people, given that the virus seems to be spreading, so rapidly in the country. Thank you.
Thank you very much, Mr. Richardson. And you specifically asked about the distribution of masks to persons who are more or less homeless to some extent, or maybe are living on the street.
There's an ongoing program to distribute masks.
Just to answer you very briefly, I've been advised and I'm aware that we are indeed looking at how we can respond to such needs of persons who are considered to be in a vulnerable category. And we are rolling out a program to do such in terms of distributing masks and other support to such vulnerable persons. You can expect that it is quite a challenge, but we will continue to do so. So I take it that we have exhausted the questions that we had to ask, and I wish to thank everyone. I wish to thank the presenters, starting with our Honorable Minister, again for the continued leadership that he's providing in the circumstance. I also wish to thank Sister Julie Russell for her sterling presentation and her grasp on what is required in the community in terms of testing and operation of flu clinic. I also thank our administrator for her very detailed presentation, and she would have apprised us thoroughly of what the requirements are when one wants to enter a hospital setting, and also she would have apprised us on our isolation capacity and what we are doing at the level of the hospital services to respond to COVID. I also wish to thank our epidemiologist for her very hard and steadfast work and for bringing us up to date with the epidemiological situation with respect to COVID here in St. Vincent and the Grenadines. I thank also the persons who have responded, Ms. Shanika John, and especially would like to thank Dr. Simone Kieser-Beach for her very hard work. Her task is not an easy one, and she has been putting shoulder to the wheel, quite a courageous lady, and she has done extremely marvelous work in helping to guide us to this stage, and we are all grateful to her. And we will continue listening to her guidance, and I beg that we all do so. I also ask that we please focus on our own individual responsibility. It's not only what the state can do or what the state is doing or what the health and other authorities are doing, but it is also what each of us can do and what each of us are doing to protect ourselves and to stay safe and to stay well. I want to assure you again that this ministry is steadfast to the task. I want to assure you that the ministry will continue to provide leadership in terms of our COVID-19 response. I also want to assure you that we will get through this. This is not going to beat us. We will get through this. Now, the world have put astronauts on the moon, and COVID-19 can be and will be beaten. Let us all stay focused, let us all stay patient and stay calm. Together, we will get through this. Please, you know what the protocols are. I need not repeat them. Please, you have a responsibility to yourself, to your neighbor, and to this nation. We will be coming to you again, and we will be having updates. I will inform you when we are having such. Stay well, stay safe, and the Almighty God will continue to keep us and see us through. Thank you, my fellow colleagues, brothers and sisters. Have a great evening. God bless.